Holidays on the horizon. You know, Halloween equals peanut butter cups.
A lot of people love those.
Thanksgiving equals overfilling my plate. And Christmas equals snacking, and more cookies. The battle against fat can be a frustrating one, but Tareen Dermatology is showing us a procedure that can help.
Indeed, Twin Cities Live reporter Kristen Hobrecht talked with Dr. Tareen to show us how the very popular Coolsculpting treatment that you've probably heard of, well, how it actually works.
Let's talk Coolsculpting. It's a way to freeze off stubborn fat. In a way, it sounds too good to be true, but explain how it works.
So Coolsculpting has been around since 2010, so we know it's a tried and tested, scientifically proven mechanism to get rid of fat. I've had it many times myself. What it is, it's a technology that uses the principle that fat freezes at a higher temperature than muscle or nerve. So we use controlled cooling to cool that fat down to a proprietary temperature so the fat cells die away while the muscles, nerve, and other good tissue are spared. And then that dead fat is slowly released by your lymphatic system, you know, your other excretory organs over the course of a few months. So it's a gradual but really dramatic process at the same time.
And it's not a major surgery. It's really non-invasive. You could just come in and still walk out that same day, right?
Absolutely, and you can do it really comfortably. So I first had Coolsculpting in 2010 after my first child, and I was able to do it just a few months after my baby and have it done wonderfully. That bulge went away, and I've subsequently have it after my other 5 pregnancies. There's an initial cooling mechanism, and that kind of freezes the fat, so you do feel a little cold, but there's no cutting, no scarring, so my patients love it because it really does give you a result, but without any significant pain. One nice thing about Coolsculpting that people don't think about is that compared to liposuction, where all the fat cells are removed, if you gain weight again, your fat goes to other places.
Who would be a good candidate for Coolsculpting?
So I see in this really funny year that we're all going through together kind of 2 groups that would be good candidates for Coolsculpting.
Okay.
Number one are people who, like me, have gained a little bit of weight during the pandemic. They're at home, they're homeschooling their kids, they're taking care of their grandkids, etc., and they're stuck at home.
Gyms are closed, or they were. Yeah.
Yes, exactly. So sometimes by getting rid of that belly or that little bit of flab around your arm or your neck, you feel better about yourself. And then you have this impetus to exercise more. So if you gain weight, you want to just jumpstart things. That's a nice little group for Coolsculpting. Option 2, the other group that's really good for Coolsculpting would be people who kind of have been exercising, because conversely, I have a lot of patients who have been exercising a lot and they've lost weight, they're really toned, but then they have just maybe a little resistant pocket, maybe a pocket here or a pocket somewhere else, where they really just want to get that pocket gone. I have patients, unfortunately, you know, young men who may have a little bit of extra fat around their chest area who may want to get rid of that. And then conversely, I've done Coolsculpting in patients anywhere 80, 90, and 100. You know, if done properly by a dermatologist, we know good candidates, people who will achieve medical grade success, and patients are so happy that, you know, even though they are in their 80s and 90s, they can get rid of these little resistant bulges, their clothes can fit better, they can feel better about themselves. As we're living longer, just because you're 90 doesn't mean that you don't want to get rid of that little bulge.
How long ago did you have the procedure?
3 months ago.
Okay.
It went very easy. It was a very good procedure. They're very professional here, and it went very well. Oh, I trust Tareen Dermatology to the highest.
Tareen Dermatology has been offering Coolsculpting for over 10 years. We've treated thousands of patients. So with experience, we're not just a fly-by-night clinic. Number 2, everything is run by me as a board-certified dermatologist, a mother of 5, somebody who's had Coolsculpting. I can place it properly, put it into the right muscles, make you really look natural, but without having kind of the adverse effects of, you know, too many cycles or too much expense or, you know, unnatural results.
Love that, Dr. Tareen. She's just so wonderful.
I've met her here a couple times in studio, and just so warm. And that's what you want with the procedure.
She's my dermatologist, and I want to see her every week. She's just so great.
Did you say she gives you cookies?
She sometimes gives me baked goods.
What is going on there?
I love her. Tareen Dermatology has a special offer for TCL viewers. You can get 1 free laser skin tightening session with a purchase of 4 Coolsculpting cycles if you mention TCL in your free consultation.
If you want more details, easy to find, just go to our website, twincitieslive.com. Next.